Hello and welcome back to the OT Meeting Room, the channel where occupational therapy practitioners come who want to make OT the most requested therapy. The information provided today is for educational purposes only. It's not provided as a professional service for medical treatment. It's not intended to be a substitute for formal education, diagnosis, or treatment. In today's video, we're going to talk a little bit about the science behind mirror therapy. I am sharing with you some slides from various presentations that I have given when I talk about using mirror therapy to help improve upper extremity function for people who have had a stroke. What is mirror therapy? Well, it is an effective intervention for treating stroke survivors who have hemiparesis, paralysis, hemi-inattention, as well as some other deficits that occur resulting from a stroke. Essentially, we are using a mirror to create a visual illusion. This intervention, it's simple, it's economic, and it's effective. Well, when we use mirror therapy with our clients who have had a stroke, we are producing neuroplastic change. And neuroplasticity is the brain changing, and it changes on 4 different levels. Number 1, through the growth of neural tissue. Number 2, through synapse formation. 3 is through cortical excitation and representation. These are the different brain regions that are firing and wiring and rewiring. And when all of that is going on, eventually we will see some sort of a behavior change. It might be improvement in motor function, maybe sensation changes improves, and even cognitive function can improve. Essentially, mirror therapy helps improve communication between the 2 hemispheres of the brain, the right and the left hemispheres. We use a visual illusion, which is created by movement of an intact limb in front of a mirror that the brain perceives as the injured or that paretic limb. This activates damaged brain areas throughout the brain. We have what is known as mirror neurons located throughout the brain. They can be found in the premotor cortex, the primary motor cortex, the inferior parietal lobule, and the corticospinal tract. And we can stimulate these mirror neurons through observation. So anytime we're looking at something, we are stimulating mirror neurons. We can stimulate them through imagination. So just like the child who has the superhero cape on, imagining he's a superhero, we can also stimulate those mirror neurons through imagining movement and also through performance of an action. We have our client move their normal limb in front of a mirror. They hide the paretic limb either behind the mirror or on their lap. Essentially, it's out of view. And when they move that normal limb in front of the mirror, it activates the primary motor cortex and many other brain areas. And that stimulates neuronal excitability, both within affected limb regions and throughout the brain. So these mirror neurons, this whole system is activating motor processes through observation of that reflected hand movement. And this can trigger movement of the unseen limb. So essentially, we have ipsilateral and contralateral brain activation. This is very important for recovery from stroke. The research tells us that we need to have a multisensory, enriched, interactive experience in order for change to occur. So this would include movement, thinking skills through our cognitive processes, and using our visual perceptual skills as we interact with the environment. This can be difficult to facilitate for a person who has had a stroke, which is why mirror therapy is pretty neat because it provides opportunities for all three of these to occur. In summary, we are using a visual illusion to reorganize brain activity. We activate the mirror neurons, and in so doing, we are activating motor processes as well as sensory and cognitive processes within the brain. Here are a few quotes that I wanted to include from the research that I've used in my presentations, just thinking about the impact of mirror therapy on recovery. In the evidence-based review of stroke rehabilitation, they state that mirror therapy on its own or in combination with other interventions can improve many aspects of upper limb function following stroke. These next two quotes are from older articles, but I do include older articles in my research because I think it's important to demonstrate how long an intervention has been around and just kind of to prove to you that we are still not implementing mirror therapy to the degree that we could be for people who've had a stroke, which is why I'm making these videos, by the way. So Dole and colleagues from 2009 state, the illusion has the greatest impact when survivors have no limb movement, leading to greater therapeutic effect. And then Ramachandran, who, by the way, is the person who discovered mirror therapy, he stated, given the simplicity of the procedure, there is no reason it should not be implemented routinely as adjuvant therapy. And I do agree, which is why I am making these videos. What can you do next? Well, you can take the PESI continuing education course if you're interested in using mirror therapy and learn more about it. This is a course that I taught for them. It's called Upper Extremity Mirror Therapy for Rehab, What's Behind the Reflection. I know they have other courses where they have some certifications where they've included information on mirror therapy. So it depends on how deep you want to go. But this particular course will set you up well to start using it in your clinic. You can also check out the OT's Guide to Mirror Therapy that I have put together. It's a nice document for therapists who want to use this with their clients. There are videos, there's video demonstrations, there's video instruction for you as a therapist, as well as a little bit of an explanation for your clients, so you don't have to do all of the explaining if you find that a little challenging to do. You can, if you want to dive deeper into stroke recovery in general, check out the Noggins and Neurons podcast that I do with my co-host, Doro Zuliger. And if you want to consult with me or if you need some mentorship, please feel free to reach out to me at info@creativeconceptsot.com. Let's see what kind of changes we can make in the therapy world together. Make it a great day. Thanks for watching.